Hi, I'm Dr. Jonathan Berman. I'm a plastic surgeon and I practice in Boca Raton, Florida. I've been in practice for just about 30 years. We've had a lot of questions about different operations, and so I've made a bunch of little videos to help try to answer some of the common questions that we receive. This little video will discuss tummy tucks. So the first question is, what is a tummy tuck? How is it different from liposuction, for example, for the abdomen? Well, liposuction is a great operation for the right person, as is a tummy tuck a great operation for the right person. Typically, a tummy tuck is best performed on men or women that have a lax abdominal wall, excess of skin over the abdominal wall, and a little bit of fat above the abdominal wall and underneath the skin. Typically, we would perform a tummy tuck whereby a woman who has had a baby and her belly has stretched out quite significantly from the baby and the skin has not retracted very well, and there are a lot of stretch marks in the skin. So many of us have seen cesarean sections where the incision goes like this around the lower abdomen. Well, the tummy tuck incision is an extension of the C-section incision about 2 inches to the right and 2 inches to the left of the C-section, going from hip to hip. That's where the incision is made. We make another cut, a circle around the belly button. We pull the skin, we dissect the skin and fat layer off of the abdominal wall, pull it up to here where the rib cage is. Then we tighten the abdominal muscles in the middle. And after we tighten the abdominal muscles, we flex the bed from the flat position, which the patient sits in, to maybe what we call a park bench position. And then we pull the excess skin downward, cut that away. We then make a new hole in the skin for the belly button, sew the belly button in place, and with that cut skin, we then sew that incision closed. Simply, that's a tummy tuck. A tummy tuck surgical procedure takes me to perform under general anesthesia anywhere between 3.5 to 4.5 hours, depending upon the patient, the amount of work that needs to be done, etc. The surgery after takes 3.5 hours to 4.5 hours. When the surgery is done, you'll be in the recovery. We'll have you then put in a recovery room bed that'll be flexed like a jackknife position like this. And then you wake up and we'll have you walk kind of hunched over for a good 5 to 7 days, so that allows the skin to relax a little bit, so you then be able to stand up straight. The biggest discomfort people have following the tummy tuck is not from the incision itself, but for the muscle tightening sutures that we put in the midline to kind of make the convexity of the abdomen more flat and straight. So that's why we recommend that you don't take up or do any strenuous physical activity for probably about a month after surgery. Typically, I tell my patients that are tennis players, I don't feel comfortable with you getting on the tennis court for a month, and you're certainly not going to try doing your overhead serves for maybe 5 weeks, because it's going to be very hard to stand up and stretch and extend yourself until everything is in a better healing phase. What I mean by a better healing phase, it's going to take 4 to 6 months for everything to heal. But after 4 to 5 weeks of the surgery, you're going to feel well enough that you feel comfortable to try to endeavor to do more physical activity. Certainly, very few of us have the luxury that they can sit tight for a month after surgery. So probably after 2 weeks, as long as the big problem people have is to get around. So after 2 weeks, you're probably able to drive a car comfortably, get out of the driver's side, walk to the office, and perform your desk tasks easily. I'm not going to let you get on a Peloton. I'm not going to let you work out for a good 3 to 4 weeks after your surgery for the similar reason. You're healing, but I don't think it's safe to go on to do the things until 21 to 28 days after, for the potential complications that can occur or the amount of discomfort and pain you may get for trying to push it a little bit too early. In terms of eating and bathing, You'll be able to eat regular food probably by the second or third post-operative day. We'll give you a stool softener to use for the first week so that when you bear down to have a bowel movement, it'll be much easier to do if you have a stool softener in it. Having a stool softener than without a stool softener. The pain medication also that we give unfortunately affects the GI tract and it tends to slow things down. So we know that you're going to be uncomfortable. We know we're going to give you some pain medications. So we want to be very parsimonious with the pain medicines so that you don't get a lot of constipation, you don't get a lot of gas, you don't get nauseated, and you don't vomit from the effects of the pain medication. Certainly you'll be put on antibiotics for a good 5 to 7 days after the surgery. Patients are usually super happy from this operation because they have an unshapely figure in the midsection and they get a hanging abdominal skin flap, or called a pannus. So if you giving people a better shake of creating a better waistline and taking away a lot of excess skin, their pants fit better, their clothes fit better. I know there's somebody, let me finish this little video, and they will usually do fine, but we kind of have them to take it easy after the surgery so they'll heal very, very well. The last question that people tend to ask, am I a good candidate? If you remember at the very beginning of our conversation, I mentioned that liposuction versus a tummy tuck are two great operations. The question was, which one am I a better candidate for? That's why you need to see me or another plastic surgeon to best evaluate you so we can answer that question intelligently. Typically, for a young, healthy person who just has a little bit of extra chubbies on their abdomen and flanks, liposuction may be the better call versus an older person who doesn't have the same amount of chubbies in the abdomen and flanks, but has some abdominal laxity and excess skin, then the tummy tuck might be more appropriate. Thank you very much for your time and attention. And if this operation or liposuction is something that you're interested in, please feel free to give my office a phone call at 561-417-0171 and set up an appointment for me to examine you and discuss your surgical options. Both operations are sensational. I have very many happy candidates or happy patients from the surgeries, and I look forward to helping you achieve your cosmetic goals. Thank you very much and have a great day.